So hi, I'm Brianna. I'm one of the chiropractors here at Move to Move, and today we're going to be talking about pelvic floor and abdominal bracing and all things to do with pregnancy. So we have Olivia here. She is not pregnant, but she is going to be my pregnant model today. And the first thing we're going to talk about that's very important for pregnancy and before and after pregnancy is abdominal bracing. So there's 4 main steps I like to teach my patients for abdominal bracing. The first one is how to find a pelvic neutral position. So Olivia, I'm gonna have you try to arch your low back off of the floor as far as you can. So this position with the pelvis there is called an anterior pelvic tilt. Then you go all the way the opposite way, try to tuck your tailbone under. So I often give a cue, like if you're a dog, you're tucking your tail between your legs, and that's gonna be the portion of what we call a posterior pelvic tilt. So I want you to do a couple slow back and forth. And this can be a great exercise in itself. You can do it lying on your back, you can do it on your hands and knees, you can do it standing or sitting. It's a great way to get some movement and some motion and some fluidity of your pelvis. So once the patient understands how to do this, then you're gonna come halfway in between your 2 tilts. And this is called pelvic neutral, and every pelvic neutral is different. So yours will be a little bit different from mine. There is not one right pelvic neutral, but it's where you feel the most confident between the 2 and that you're fairly level with your pelvis. So Olivia has a beautiful pelvis here. It's equal both sides. She's not arching her back or tucking under, but she's still got that little bit of space underneath her spine, and that's normal. So that's step 1 of abdominal bracing. Step 2 is, Olivia, you're gonna take a huge breath in as far as you can. You want all the air to come into the belly. And then you're gonna exhale all the way, pulling that belly button down towards the spine. Good, so practice a couple of those. So Olivia and I talked previously, and we've trained her to do this, where initially she was breathing right up into her chest and expanding her chest, but she actually had her belly sucked in the whole time, so she wasn't even getting any air down through her actual lower diaphragm. So now when we've gone through it and talked about it, what's happening now is Olivia can actually bypass her chest and mostly breathe into the deep belly. So that's helping to expand the abdominals, to expand the diaphragm, and to train your actual breathing habits. Most adults start to chest breathe as we get older, whether that be for aesthetic purposes or from stress. We hold a lot of stress in our neck and shoulders. And so we forget how to breathe into our bellies. But as a baby, if you watch your newborn, you will always notice they are breathing constantly in and out through their belly, expanding and contracting it. So we have to remember this and bring it back to adults too. So the second step of abdominal bracing is to take that air in, expand through the belly, and then we're gonna pull everything else down. The belly button's gonna be pushed directly to the back through the spine. And you notice there how Olivia did not change her pelvis. She did not let anything switch or move through the pelvis there. So after that's done, we have a neutral pelvis, we have our belly button pulled to the spine. We're gonna also focus on the upper abdominals here, just closing off the rib cage a little bit. So trying to get some pressure this way. So this will also help if you're having a hard time breathing and you're only breathing into your chest. As you exhale, you can kind of close off the rib cage, feeling all your abdominals contract from the sides and pulling down. And that way we've got a brace from the very lower abdomen and also right up to where your sternum starts. Okay, so let's review those 3 quickly. So come into a relaxed, normal position in general. Okay, you're gonna do a couple of pelvic tilts back and forth just to get used to what they feel like. Good, so you can see that nice curve of Olivia's spine as she's tilting her pelvis back and forth. And now find your neutral halfway between. Good. So without letting your pelvis switch from this position, you're gonna take a big inhale right into the belly. So big belly expansion, pull up, 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 and then exhale all the way. Pull your belly button down right to the spine. Good. Now at the end of that, contract those ribs. Okay, so now if Olivia was to trip in the snow or on the ice, or someone was to say hey and shove her a little bit, she would be braced. She wouldn't be able to fall because she's activated. So from this last step, we've talked about 3/4 of a box. So we've talked about bracing the pelvis. We've talked about pulling down on the pelvic floor. We've talked about contracting the ribs. And then the last piece of the box is coming from the pelvic floor itself. So your Kegel muscles, they're commonly used especially in birthing books and everything that way. Those are the muscles that stop the flow of urine. So your pelvic floor is a crucial part of pregnancy because there's so much change happening down there. There's so much expansion happening through your belly, through your uterus, and a lot of moms don't have enough strength. They haven't trained it for years in advance before having a baby, and then they have even more problems after having a baby because everything's been stretched out. A lot of women get pelvic prolapse, or they'll get the sneeze and pee where they can't hold their urine, or they'll get stress incontinence where, say, they can't run anymore because they pee themselves every time they start to run or jump. So the pelvic floor is crucial to pregnancy and to everyone before and after, and men too. So the last bit here is we're going to talk about the Kegel muscles. You're going to pretend, Olivia, because I can't really see these, you're going to pretend like you're going to the bathroom, so you're letting your urine out. And then I want you to slowly try to stop your urine. So you're going to pull up on your pelvic floor, up on those Kegel muscles. And that will be the last part of our abdominal bracing to keep our core structured and healthy that way. So when we talk about the Kegel muscles, we can incorporate what we call Kegel elevators into this. So if you imagine that ground floor is just a neutral feeling through your pelvic cavity, that's where we're going to start. And we're going to have multiple floors like we do on an elevator. We're going to get all the way up to the penthouse. So the penthouse is the highest level your pelvic floor can reach up to. And then we're also going to be able to train from the ground floor down into the basement. So I was telling Olivia earlier that a lot of women focus on elevating the pelvic floor and holding tension in the pelvic floor, but then they go and have a baby and they're told to push, and they can't push, and they get super tense and they hold everything in, and then they have a really long delayed labor because they have not trained how to relax their pelvic floor muscles and let them go. So when we talk about the ground floor, we talk about elevating our Kegel muscles, but then we also have to learn how to relax our pelvic floor to be able to push without too much pressure so that the baby can easily start to come out during labor. So we will go, Olivia, we'll kind of keep your nice brace in itself, and then I want you to slowly start to build pressure in your pelvic floor. I want you to build to about a level 3, okay? And then you're gonna relax that a bit. So you're gonna drop down to floor 2. Okay, and then from there, you're gonna pull up. You're gonna go back to level 3, level 4, and then we're gonna get right up to the penthouse, level 5. So you're gonna pull up as hard as you can through your urinary muscles, but also you'll feel your muscles along your perineum and actually towards your anus pulling up as well. And so that is also part of the pelvic floor. So in layman's terms, you're holding in your pee and you're holding in a bowel movement right now. That's as high as you can go, okay? And notice here, when Olivia is doing this, she did not let her pelvis tilt at all. So that's crucial. All right, so from the penthouse, you're gonna slowly start to drop to level 4, drop to level 3, go back to level 4, go to level 2, so slow down through 3, and then go back to ground, so slowly through 1, back to relax. And now I want you to focus. If you had to pee so bad that you couldn't hold it, you wouldn't have to push. You would just have to let your pelvic floor relax and your urine would come out. That's going into the basement. Does that feel okay? Yeah? Okay. So then from that point, you can contract your muscles now to push even more. And this is like when you're having a bowel movement or when you're forcefully pushing out your urine. But if you can pay attention to the difference between just relaxing the pelvic floor and then pushing down on the pelvic floor, those are two different scenarios that you should become comfortable with before you give birth. Okay, makes sense? So that's a lot. We talked about the pelvic floor a lot. We talked about Kegel elevators. We talked about going to the penthouse, going into the basement. And then we talked about the 4 steps of abdominal bracing, which is pelvic neutral, your belly button to your spine, your ribs kind of shortening and closing off, and then holding up your pelvic floor. So you've created a nice box. And I tell patients that you have to train your exercises. They should be functional, so you need to train these exercises in multiple positions. If you get good at doing abdominal bracing on your back like this, great. But that doesn't help you when you're walking, doesn't help you when you're squatting, when you're sitting. So you have to train this at all positions, all parts of the day. So that's one of the most important things. So that's abdominal bracing.